Did you know that osteoporosis affects millions of people around the world? And the worst part is that many people don't even know they have it until they suffer a fracture. But don't worry. Today you'll find out everything about osteoporosis. What it is, its causes, symptoms, and most importantly, how to prevent it and strengthen your bones naturally and effectively. Stay with me until the end because there are practical tips based on science. What is osteoporosis? Osteoporosis is a silent disease that weakens bones, making them more fragile and prone to fractures. It occurs when there is a loss of bone density, something very common in the aging process, especially in women after menopause, but it also affects men. Causes of osteoporosis include natural aging, menopause with low estrogen levels, calcium and vitamin D deficiency, a sedentary lifestyle, excessive alcohol and tobacco consumption, prolonged use of certain medications such as corticosteroids, and diseases like arthritis, hyperthyroidism, and kidney problems. Osteoporosis is known as a silent disease. Most of the time, it does not present symptoms until a fracture occurs. However, some signs may appear, such as back pain from vertebral fractures, loss of height, stooped posture, and frequent fractures, especially in the hip, wrist, and spine. Did you know that 1 in 3 women and 1 in 5 men over the age of 50 will suffer osteoporotic fractures, and that after a hip fracture, about 20% of people do not survive the first year? This shows the seriousness of osteoporosis and the importance of prevention. So how do we prevent and strengthen bones? First, have a diet rich in calcium. Think milk, cheese, yogurt, kale, spinach, broccoli, almonds, and sesame seeds. Second, get some sun to produce vitamin D. At least 15 to 20 minutes a day should do it. Third, consider supplements when necessary. This might include vitamin D, calcium, and in some cases, magnesium and vitamin K2. Fourth, exercise. Weight training, walking, Pilates, and activities that generate controlled impact on the bones are great options. Fifth, avoid alcohol and cigarettes. And sixth, control associated diseases like diabetes, arthritis, hyperthyroidism, among others. When should you seek medical help? Well, if you are over 50 years old, have a history of fractures in your family, early menopause, or other risk factors, it is essential to see your doctor to assess your bone health. A bone densitometry exam is the main diagnostic test. Osteoporosis can be prevented and treated. And the sooner you take care of your bones, the better your quality of life, your autonomy, and your longevity will be. If this content helped you, like the video, share it with those who need it, and subscribe to the Viva Maze and Melhor channel. Here, your health comes first.